Do you think they're going to do another COVID-19 on us in the future?
I say bring it because people will rise up. I mean, I don't know if I posted something under CDC, their post last night. And I said, well, listen, we're not listening to you this time, right? You've lost all credibility. And people have been a little bit quiet on COVID because it's not a threat anymore and people are moving on with their lives. The best thing that could happen is for them to try to shove this down our throats again, because people will rise up and then maybe we can actually get some accountability for what happened during the pandemic and get some action taken, because it's been very frustrating that nothing has happened. I mean, 7 million children got the COVID shot this year. We still have 20% of healthcare providers are pushing their patients to get these shots. 29 states recommend that all babies get 3 COVID shots by the time they're 9 months old. It's completely insane. And our HHS is ignoring this like not a big deal.
Yeah, why do you think our HHS is ignoring it? I mean, we do have Robert F. Kennedy Jr. now as the Secretary of Health and Human Services. So what do you think is going on with that?
I think it's Trump. I mean, Trump apparently got a booster this year. He was one of those millions of Americans that got one. He has not backed down from the COVID shot. He still thinks it's the best thing he ever did. He's refusing to acknowledge all the injuries. I mean, to this day, I still see patients almost daily in my office who have severe reactions from these shots. I mean, I've never seen anything like it with any other product on the market. None of the people that I've seen with injuries have been reported to VAERS. I'm the one that's reporting them. So we know that VAERS is vastly underreported. And they're very difficult to treat. I will typically try ivermectin, and I've had some success with that, but a lot of these patients don't respond to anything. I mean, you throw everything we can think of at them and they still don't get better. And these are not subtle problems. These are like life-disabling issues. Severe tremors, severe fluctuations in blood pressure and heart rate would make it impossible to exercise or really feel normal ever again. I've seen some really bad rashes, recurrent hives, tremors that won't stop. And then a lot of people just suffer from really debilitating fatigue and brain fog.
Sometimes I lose hope a little bit because, I mean, for the most part, people have not, we stopped talking about COVID, right? We've all moved on. Everybody just wants to move on with their lives. But the other night I was at dinner with a group of people, and a couple of the people, one of them being a doctor and her friend, sat there and started talking about how, oh, well, at least we were able to get the shot really quickly. And, we were able to get access to the COVID vaccine. And, it was just, they were still talking about how grateful they were to be able to get the vaccine so quickly. And it's just mind blowing to me that they still believe that that was something that and we're talking about young, healthier people that, and then I'm sure they got COVID anyway, which I didn't want to ask because I did not want to bring up the conversation or open that can of worms. But I just thought, and I wonder how many times they got COVID anyway. And then but there are times when I do bring that up to somebody, well, you still got COVID. And they say, yeah, but I would have died if I wouldn't have had the vaccine. And it's like, well, I didn't die and I didn't have the vaccine and I got COVID. And a lot of other people, we didn't, it was, yes, people died, but people died that had serious comorbidities and, that did happen. But it's just amazing to me that still now, years later, a lot of people still believe, no, they're still holding on to that narrative. We just don't talk about it. So that's kind of where I lose hope a little bit, because I think right now we think, okay, yeah, we've moved on and maybe we have learned our lesson, but I'm not 100% certain of that. I worry about that.
I know. But people also don't want to acknowledge that they might have done something really wrong and injected something dangerous in their bodies or in their kids' bodies. I think that's hard to grapple with. I think what's going to happen, though, is the cancer data is starting to come out. So they've been sitting on it since 2022. And we just got numbers from 2023, and they are very alarming. It's in cancers under age 50, we're seeing a huge increase, up to 20% increase in colorectal cancer in age under 50 from 2022 to 2023. Just went, it's pretty, it's not subtle.
Yeah.
So that's going to be hard. You know, they're gonna be very reluctant to release that cancer data, but the more that comes out, people are going to start to realize. And often it just takes people to realize it firsthand. You know, it happens to them or happens to a loved one before they're willing to admit that there might be a problem.
Well, I will say I've known a couple of people in my life in the last few years that have died of cancer from turbocancer. I mean, it just hit them and then they were gone. Mm-hmm. And that was it. And there was no real stopping it. It kind of hit them like a freight train. What do you think it is that is what is it about the vaccine that causes the turbocancer? Because part of me wonders with turbocancers, you know, like with the pandemic and the shutdowns, we didn't have access to anybody. I mean, doctors hid away and wouldn't see patients. So, you know, I've kind of wondered, is it the vaccine that causes the turbocancers? Like, is there something about that technology or something about that virus and the spike protein or something? Or is it that people didn't get the care? They also stopped walking. They were eating poorly, right? Like we weren't getting sunlight. You know, there was years of just a hindrance to our overall health. And so I'm curious, do you think it was more absolutely it's the vaccine, there's something in it, and do you know maybe what that is? Or do you think it's like overall lifestyle health suppression that happened during the COVID pandemic?
Well, and I don't think it's purely the vaccine. It's also the virus, but the spike protein has shown to inhibit P53, which is a tumor suppressor gene. The mRNA that enters into the cell is not supposed to enter the nucleus, but it's possible it can enter the nucleus. The lipid nanoparticle that the mRNA is enclosed in can cross the nuclear membrane of the cell. And if it crosses the nuclear membrane of the cell, then it can hamper the DNA of the cell and cause issues. We know that there is excess DNA contamination that's been found, and I think there are 8 different studies, maybe more now, showing excess DNA contamination. When they're doing the production process of these shots, they're supposed to remove this excess DNA. So they're using the DNA to produce the product, and then it's supposed to be washed out, but there's a threshold of amount that's allowed to be in there, and multiple studies have shown excess DNA in there, and the reason you don't want that excess DNA in there is the potential for cancer. If you look at the timeline of how these cancers are going up, it coincides with the rollout of the shots. Now, that's not definitive, but it's a smoking gun.
Yeah. Well, and you're saying the COVID virus itself could also cause it. I mean, obviously, I think, you know, everybody ended up getting the virus, but then on top of it, if you gave yourself an injection, you know, multiple times, then I would think that there would be even more likelihood of negative things happening or whatever. But so you think that the COVID virus itself also could be causing turbocancers, which if that's true, by the way, and if it does turn out that this was gain of function research that ended up causing this, I mean, that is extremely it was already criminal, but now we're talking extremely criminal.
Right. And the other concern is amyloid. So the spike protein, we think, is having people form amyloid, which is an abnormal protein that's hard for the body to break down. Many people have heard of amyloid because there's a thought to be an association with Alzheimer's. But what we are seeing in patients who've had COVID and people that have had the COVID shots is this abnormal amyloid production. And we think that that's why they're so difficult to treat. They're because you can't break this down. And we're trying to bring a treatment over from Japan. So there's one promising treatment being performed there in a small hospital where they're filtering out the amyloid, and then they're giving patients stem cell growth factors. And that seems to be helping. But unfortunately, the technology is not approved in the U.S. It's been used in Japan for a lot of different diseases, not just long COVID or vaccine injury. So it's tried and true in Japan. It's just not approved in the U.S. So we're trying to bring that over to the U.S. to do trials.
I mean, at this point, if somebody's, what could anybody do? I'm sure there's a lot of people who, they fell for the narrative, they got the vaccine, they did it because maybe they fell for the narrative, or they just wanted to live life. They wanted to be able to work. They didn't want to lose their job. They wanted to be able to travel. They wanted to be able to join society in some way. And now they're worried, what if I end up getting a turbocancer, or my loved one just got a turbocancer and died and I might be next? Like, is there anything people can do to, mitigate the possibility?
It's a common question I get. I would say that not all these shots are the same. I think because they were rushed out so quickly that there were very wide discrepancies in the quality of the product that got injected in people's arms. And we were also very temperature sensitive. So I do wonder, like, these people that went to the stadium and went through a drive-through, and especially in Houston, how they got the product that was intended to be given. So when they looked at the V-Safe data, which is an app they gave people after they got the shot to report side effects, 7% of people ended up having to go to see a doctor. And that's pretty consistent with what I was seeing right after the shots. In the first 2 years, I tracked my new patients, and 7% of my new patients were coming to see me for injuries. So I would say the vast majority of people out there are probably okay, but there are a large number of people out there who've been completely abandoned by the government, who are very resistant to treatment, and it's not a small number. But hopefully, odds are, if you're okay now, you're probably going to be okay, and there's a good chance you didn't even get the product that they intended you to get.
Let's talk about your book. If there is one COVID book you need to read, it is this book. It is called Dangerous Misinformation: The Virus, the Treatment, and the Lies. Tell us about this book that you're coming out with. It's coming out in just a couple of weeks, less than a couple of weeks.
Yeah, it's sort of my tell-all survival story, sort of the gory details. I was a solo ENT, very small, quiet practice, and I just stepped on the toes of a gigantic hospital. It was Houston Methodist Hospital. They were the first in the country to mandate the shots. They did this on April 1st, 2021. They did it 5 months before Biden. And I think it was very purposeful. I think they knew if they could get away with the mandates in Texas, they could get away with them anywhere. And I had privileges there. I actually had a great relationship with them. I was collaborating with them on research. But then I started noticing things they didn't want me to notice, and they came after me viciously. They suspended my privileges, and I found out through a reporter at the Houston Chronicle. So they went straight to the media. They purposely blew it up in the media. They tried to destroy me. And I fought back very hard. And I'm actually still fighting. So I'm still fighting Methodist. I'm still fighting the medical board. They turned me in the medical board. So it's just a chronicle of the story. And hopefully the sequel will be my victory story, because unfortunately it's not over.
What do you mean it's not over? What are you still fighting?
I'm still fighting the medical board. So I was turned in because I tried to help a dying man. He's father of 6, sheriff's deputy. The hospital was saying that there was nothing else they could do and wanted to put him in hospice. And the wife sued to give him ivermectin. We actually won the lawsuit. I testified. And the court ordered the hospital to give me emergency temporary privileges. The hospital bent over backwards to prevent that from happening, but I got the green light from the lawyer who was doing all this and sent the nurse to the hospital. She was greeted by the police. The man never got the ivermectin and eventually died, but they turned me to the medical board because they said that I caused a scene at the hospital and didn't have privileges when I sent the nurse. And I'm just fighting. I don't think they're not trying to take my license, but they're trying to fine me and make me take all these hours. And I'm just fighting on principle because I was, working on the behalf of a patient. I was following a court order, and they're going after me for political reasons.
Yeah. And you're a big believer in ivermectin. Is that right?
I was nervous about using it. I was using monoclonal antibodies. They worked really well. And then the government took them away. It became harder and harder to get. And I still had sick people coming. So I said, well, I'll try the ivermectin, but I was a skeptic. But what I found was that it did work. So I treated over 6,000 COVID patients during the pandemic. About a third of them I used monoclonal antibodies on. And about 2/3 of them I didn't have monoclonal antibodies. So I used ivermectin often in conjunction with other medications. But I was still having great success using the ivermectin and other medications, despite not having the monoclonal antibodies. And it's incredibly safe. And I really dug into the safety first before I started using it, because I knew that was going to be the big controversy. But you can't even find overdose reports in the literature. And if you look at the amount needed to overdose, it's incredibly high.
Yeah. And you said recently in a tweet that hantavirus is an RNA virus and ivermectin should work against it.
Who knows? I mean, it might. When you look at the mechanism of action, how ivermectin works, at least in the lab, against viruses, it makes sense. I couldn't find any studies where they've tested ivermectin against hantavirus, but it is a logical place to start. If they don't give us anything but a vaccine, then I'd probably start with something like ivermectin.
Yeah. All right. Well, the book is Dangerous Misinformation, the Virus, the Treatment, the Lies, and that we do have the link to the pre-order down below. The book comes out. What day does it actually drop?
May 19th.
May 19th. So it's coming right up. So you can pre-order the book. We do have the link down below. We also have the link to follow Dr. Mary Talley Bowden on X. Is there anywhere else you want people to go?
I have a Substack as well, and I do a podcast here and there that I post on my Substack.
Okay, so we'll put the link to Substack down below as well. Dr. Mary Talley Bowden, thank you so much for being here and giving us this insight, and thanks for fighting the good fight during COVID. I've talked about you many times on the show, sharing a lot of the information that you've shared, and you've been a real fighter during the COVID pandemic, and I know many of us thank you.
Thank you, Kim.
Thank you for watching this clip from the full Kim Iversen Show, which you can watch Monday through Friday, 5 p.m. Eastern, 2 p.m. Pacific at KimIversonShow.com. See you there.